The Delta variant of the coronavirus has exposed global inequalities in access to vaccines. While many rich countries have vaccinated most of their populations, poorer nations are struggling to obtain doses. Europe has administered, on average, about 90 doses per 100 people. Africa, meanwhile, has only reached 6 doses per 100. Some countries, including Germany and Israel, are planning to give extra booster shots to their most vulnerable people. But just 1 in 1,000 in Haiti and the Democratic Republic of Congo have received even a single shot. The situation is also dire in Kenya, where the Delta variant is spreading rapidly. DW's Mario Muller and Felix Maringa report.
A family in grief. In less than 2 weeks, 3 of its members have died of COVID-19. It went very fast. James Mwangi tells us he buried his father just a few days ago and his grandmother the week before. Today, he's burying his uncle.
We are traumatized because it's not so easy. Some people, you are with them 2 weeks ago, they had no issue. Then all of a sudden, in a span of less than 10 days, they are all gone.
At his father's grave, he pays respects before joining his family at his uncle's funeral. James is struggling to understand what has happened. So too is his aunt.
My heart is in a lot of pain. I don't know what to say. If people had gotten the vaccine, I think even those who were sick could have healed.
The family is convinced their loved ones could have survived had they been vaccinated. With many rich nations having inoculated more than half of their populations and even started to roll out third booster jabs, poor countries are lagging behind. The WHO says the vaccination rate is as low as 1% across the continent. Health experts say this vaccine inequity is also a moral issue.
We cannot start administering booster shots when some of us don't even know if we will be able to get a second shot. It's just a really great injustice, and it's unfortunate that WHO's hands are also tied.
Many Kenyans we meet in Nairobi agree.
They have the obligation to help, so I don't think if it's something bad, they can do it since we all need the vaccine.
They have protected their people and their citizens, but they have neglected these needy countries.
If you find out that we are not vaccinated, then the rate at which the virus will be spreading, it will be very high. And I think that's the reason as to why most of we Africans are dying.
At the burial, James Ndwati, a member of parliament, tells the family he did everything he could to purchase vaccines for Kenyans.
We put in money to buy vaccines. But one of the challenges of the vaccine is that they are not available anywhere. Globally, African citizens have been treated as second-rate citizens.
The surviving family members were tested negative, but they're still worried because they don't know when and if they'll get vaccinated.
If vaccinated, Granny might have died because she was old, but the other 2 could have survived.
Until low-income countries get their fair share of vaccines, family tragedies like Monica's will continue to happen.
I'm joined now by Achim Steiner, Administrator of the United Nations Development Programme. Welcome, Mr. Steiner. There is talk of booster shots beginning next month in the US and Germany, while at the same time, just 2% of Africans are fully vaccinated. Is that acceptable to you?
I don't think it is acceptable to anyone, and I think it is a dilemma. It is also a crisis that we have to confront head-on right now, because not only is it a moral dilemma, I think we have just heard from some of those who spoke from the African continent. This is a moment of great inequity, of injustice, but it is also one that we have failed to prepare for properly. And I think that is why it is both a responsibility and an opportunity for everybody to step forward, but particularly those countries that have the means to support those that have had virtually no access to vaccines so far.
Are rich countries doing enough to help vaccinate the developing world?
Well, I suppose the simple answer is no. The more complex answer is we are in a moment in time in the midst of this pandemic where there simply weren't enough vaccines for everyone to immediately roll out a campaign to vaccinate 5, 6, 7 billion people. So I think from the point of view of did we prepare well enough, did we do enough, clearly that is not the case. Otherwise, we would not be in this situation right now, which the vaccine dashboard that the UNDP, WHO, and University of Oxford have now provided almost on a daily basis, providing an illustration of the inequity becoming more extreme. We face a challenge clearly right now, which is to get more vaccines to more people on the one hand, to also speed up the production. And it is on these two tracks that the international community must act, and particularly richer countries and countries that also have excess or surplus vaccines right now clearly are called upon to act with a sense of common solidarity, but ultimately also self-interest, because we know that this pandemic will simply not end without vaccines being available to the world as a whole.
With that said, can we name names? Which countries are not pulling their weight in this regard?
Well, I think you can go to the WHO website, you can look at the COVAX website, you can look at the commitments that have been made at the G7 summits, G20 summits. Largely it is the wealthier countries, it is also the countries that have the manufacturing capacity. I think they are well known, they are at the center of the production right now globally. And it is they who both have the challenge of looking after their own citizens, which I think everybody can recognize. But at the same time, you also have to create more production capacity. India's own tragic wave that it experienced put a further stop to one of the places around the world where significant manufacturing of vaccines was envisaged, particularly to supply the COVAX initiative also, which the United Nations and the international community put together precisely to not find ourselves in a situation today where those who can afford to buy and manufacture the vaccines essentially also control access to them. This is a situation which we are trying to address, and I think we have seen many political leaders speak to this, make commitments, but this is the midst of a pandemic. Words don't count, it is actions that count, and I think we have to look at this both from an epidemiological point of view, but also from a recovery point of view. Right now, we actually could use debt service payments. Just 1% of global debt service payments in the year 2021 would buy 1 billion vaccine doses under the COVAX facility. This is perfectly financeable, and I think it is a moment in time where the world really has to step up. Both those who have the ability to produce and to supply more vaccines, and countries who have to put in place the systems for delivery of vaccines.
Let's use the G7 as an example. They have pledged almost 1 billion doses to COVAX, the distributor in places like Africa, before the end of 2022. Do we now know that that's simply not going to be enough?
Quite clearly, it is not enough. Africa is experiencing, one of those moments that we have seen repeat itself across the world at different moments in time, when infections surge, when the ability of healthcare systems is on the verge of implosion. And even if vaccines were available, let us also be clear, for many low-income countries, there is a need for financial support. The ability to buy and purchase vaccines is one of those things that I think should remind us all that the access to vaccines should not be a matter of whether you can afford to pay for it. We are wealthy enough as an international community, as a global economy, to be able to vaccinate everyone. The example I just gave you just on debt forgiveness is just a simple illustration. And I think ultimately we know that global economic recovery is premised, as the IMF and many other economic institutions have also documented, on the whole world being able to vaccinate.
Mr. Steiner, if you're using this platform and you're talking directly to countries now who are maybe sitting on unused or unwanted vaccine, what's the message?
I simply repeat the message that the Secretary General of the United Nations, that my colleague Dr. Tedros of the WHO have said. Donate vaccines, provide the surplus vaccines right now. We just saw in the Kingdom of Bhutan, a poor country, in 1 week being able to vaccinate 80% of its eligible population. Countries are capable of using these vaccines. Let us make sure we share them equitably while we all move forward in rapidly ramping up production, including for future pandemics.
Achim Steiner, Administrator of the United Nations Development Programme. Many thanks for your time.
Thank you.